Gross Anatomy 1, Palpation, Lab 4. Bones of the hand, axilla region, pectoral region, superficial posterior forearm. Bones of the hand. We have metacarpals, a base, shaft, and head. We have phalanges, which include on digits 2 through 5, a proximal phalanx, a middle phalanx, and a distal phalanx. On digit 1 for phalanges, we have just a proximal and a distal phalanx. On each phalanx, you have a base, shaft, and head. Carpal bones. For the carpal bones, you have the scaphoid, you have the lunate, you have the triquetral, and the pisiform. Next row, trapezium, trapezoid, you have the capitate, you have the hamate bone, and the hook of the hamate. Metacarpals. To palpate, have the patient make a fist and display the back of the hand. You will need to identify the heads of each metacarpal specifically and the shaft of each specifically. Head are the knuckles. For example, the head of metacarpal 1, 2, 3, 4, and 5. The shafts are proximal from each metacarpal head. Example, the shaft of metacarpal 1, 2, 3, 4, and 5. Next are the phalanges. To palpate, open the hand and approach from the palmar surface. You will be asked to palpate a 3-part question. One part is a specific feature on each phalanx. For example, the base is just distal to the appropriate crease, the shaft in the middle of the phalanx, and the head. A second part is the specific phalanx. Example, a proximal phalanx, a middle phalanx, or a distal phalanx. And lastly, you will have to be specific to a particular digit. Example, digit 1, digit 2, 3, 4, or 5. Here's an example question. Go to digit 2, the middle phalanx, its head. So that would be the head of the middle phalanx of digit 2. Note digit 1, the thumb, has just 2 phalanges, a proximal and a distal phalanx. Next, the anatomical snuff box. This is a depression just lateral and a bit distal to the wrist joint. Have the patient extend their hand and abduct, radially deviate their thumb away from the other fingers. The depression may or may not become obvious, but you should be able to feel it with one of your fingers. You will need to know this feature to palpate some of the carpal bones. For example, you're going to need this area to palpate the scaphoid. Palpate the deepest portion of the anatomical snuff box, and you are on the scaphoid. Next, the trapezium. You need to also find the anatomical snuff box, then find the scaphoid, the deepest part, then slide your finger distally up onto the trapezium. Next carpal is the capitate. This is found just proximal and lateral to the base of the third metacarpal. Find metacarpal 3, slide your finger down, right above the wrist, slide slightly lateral. You will slide into a slight depression. Next bone is the lunate. First, you need to find the capitate once again. Then move your finger slightly proximal up onto the lunate. Next, carpal triquetral. First, find the styloid process of the ulna. Second, go just distal to the styloid process. You are also to have the patient abduct, which is going to be radial deviation of the hand, should make the triquetral more obvious. Pisiform. Palpate the proximal medial aspect of the palm. You should be able to find the pisiform. The hamate. Palpate the hamate just lateral and distal to the pisiform. One trick to locate the hamate involves placing your finger on the pisiform. Point your thumb tip towards the midpoint of the thumb and digit 2. Push your thumb tip into the palm, and deep should be the hook of the hamate. The pectoralis major muscle. To palpate, go just below the clavicle. Have the patient in anatomical position. To test, have the patient flex their arm, then adduct and medially rotate. Pectoralis minor is a deep muscle that we palpate its origin only. The origin is at the coracoid process of the scapula. Press deeply into the infraclavicular fossa to find the coracoid process. Cords of the brachial plexus. The cords are too deep to be palpated. You are going to point out where these cords are deep to. Find the coracoid process of the scapula and go just medial. Deep to this point should be the cords of the brachial plexus. Now we will shift to the superficial posterior forearm muscles. First is the brachioradialis, the most lateral of the superficial posterior forearm muscles. To palpate, go proximal and lateral on the forearm. To test, begin with the patient's forearm partially flexed. Have the patient continue to flex their forearm against resistance. Next, you have two muscles that we will be palpating and testing together. They are the extensor carpi radialis longus and the extensor carpi radialis brevis. These two muscles can be palpated distally and proximally. It will be your choice during the palpation practical. The muscle test will be the same for both locations, proximally and distally. Proximal forearm. Start with the patient's forearm in a pronated position. Go just medial to the brachioradialis. To test, from the pronated forearm, have the patient extend and abduct, radially deviate their hand against resistance. In the distal forearm, the tendons of the extensor carpi radialis longus and brevis muscles can be palpated next to the anatomical snuff box at the distal lateral aspect of the forearm on the radius. Next muscle, extensor digitorum maximus. We will be palpating the tendons on the back of the hand and testing this muscle. Have the patient pronate their forearm and extend digits 2 through 5 against resistance. Palpate the visible tendons, maybe only 3, on the back of the hand. The extensor digiti minimi. Keep the patient arm pronated. Look on the back of the hand using the same muscle test against resistance. Palpate the tendon to the 5th digit over the 5th metacarpal. Next muscle, extensor carpi ulnaris. This muscle is found in the medial aspect of the forearm. We will palpate it at its distal end. Palpate the extensor carpi ulnaris near the head of the ulna, just proximal to the head of the ulna. Test for this muscle is going to be to extend and adduct, ulnar deviation, their hand against resistance. The tendon should become evident. Basilic vein. You will be asked to trace the blood flow. Begin on the back of the hand, medially in the midpoint of the metacarpal area. Trace up the medial aspect of the forearm and proximal medial arm and stop about halfway up the arm. Next, the cephalic vein. Begin on the back dorsum of the hand, laterally and proximally travel up the forearm across the cubital fossa to the proximal part of the arm. Median cubital vein, trace across the cubital fossa. Direction will not be important here like it was for the basilic and cephalic veins. This is the end of Palpation Lab